Dr. Brandie here with Alyssa for part two. Last week we talked about the physical aspects. Alyssa is my strategic assistant. She's been helping me bring this mission after selling my practice and dedicating everything I have to helping OBs, patients, chiropractors, everyone involved, because this is an epidemic that nobody talks about. This is something that women carry with them. And I really wanted you guys to hear Alyssa's story. Alyssa wanted you to hear her story because if you're listening, you are not alone. And you're going to hear a lot of this in here. And what I want you to understand at the end of this is it's not your fault. And what you're feeling is totally understandable. And we want to turn it around to give you some other options. So introducing Alyssa. Alyssa, you could introduce yourself if you didn't tune in last week. Alyssa, if you could introduce yourself, that would be great.
Yeah, I'm Alyssa Roe, and I've been working with Dr. Brandie for a couple months now. And I am very excited to hopefully help at least one person with my story. I feel very passionate about this because I've been pregnant 4 times. I have 4 babies, and I mentally and physically have had awful pregnancy, postpartum, and still healing from it. So
Yes.
mentally and physically.
If you're comfortable with talking about it, I found you through an agency, right?
Yep. Being said, I have a client that she actually didn't. She just said was a doctor, and needs help with personal assistant. And I think it would be perfect for you to get your foot in the door. And I said, okay, yeah, let's meet with her. And I text you to set up an appointment, and it was right away. And yeah, we started working together right away in March.
Yep. Yeah. We've been working together since, and you're doing a little bit of, Alyssa's helping me with my OB outreach, helping me not triple book myself because I have severe ADD and executive function, and then also reaching out to people. And I think you're really seeing, like, you're my target audience, as I said, and I'm not like, you are the perfect person to have in this role because some stuff that Alyssa has said, I'm just like, no, like, so like in terms of like what happened to her. So I really wanted to highlight that today. So today we're vulnerably going to talk about mental health. Both Alyssa and I are going to talk about mental health as it relates to pregnancy, because both of us had something that no one talks about, which is pregnancy depression. And postpartum. I didn't have so much postpartum. I had postpartum anxiety because I think it's normal to have those feelings because your hormones are all over the place.
Yeah.
But postpartum depression, or not wanting to have another baby because the first one was such a shit show. With mine, I puked every day, all day, felt awful, still gained 80 pounds. Ended up getting a car accident at 36 weeks, hit head on, and was told that I couldn't go to a chiropractor because they're dangerous, which is what drives me today. There's many little feathers in my hat that like drive me to do what I do today. Literally gave me 2 dumbass stretches and told me that's supposed to make my pain go away. And I waited 8 weeks to get therapy, which again is egregious. So that was step 1. Second one was my second pregnancy, almost lost it 17 weeks, told I couldn't work. And that's when I transitioned from sports medicine chiropractor to pregnancy chiropractor. And because I couldn't work, it nearly destroyed me. I couldn't support my kid. So that's why we're here today, is talking about Alyssa's journey and talking about my journey so that we can help women feel less alone of the stigma of being depressed when you should just be happy that you're pregnant. So talk to me, Alyssa. Last episode, we talked about the physical stuff and you trying to get help from people and the dumb shit. I'm not going to censor myself. The dumb ass shit that is said to women. Talk to me about how that for each pregnancy sort of started to subsequently erode. And you'll hear some stuff in the background. As I said, Alyssa has her kids at home. She works from home, like a lot of you do. So if that's not for you, this podcast is probably not for you. So I hear that they're playing their the blinds, it sounds like.
Yes, they are. They were trying to swing like Tarzan from the blinds.
From the blinds.
So I was like, oh my goodness, you stop doing that. You're gonna rip it right off the wall. Mentally, I felt mentally with my first, I was very excited. I couldn't wait to be a mom. And then all of the like, you know, the weight gain and all the things and all the pointing fingers at me, it just caused me to mentally like just regress. And then, like I said, I had my daughter. She was 30. I was 38 weeks pregnant, almost 39 weeks pregnant, and I had complications that had me stay in the hospital for an extra 4 days. And my husband was in the academy and couldn't miss, so he would come back late at night and have to leave early in the morning. And my mom would come. Like I struggled getting out of bed. And then so then mentally I was just like, she wouldn't stop crying. Like I didn't get her to stop crying. And then I couldn't use the bathroom, which is why and then I couldn't, like, they wanted to do a catheter, but I was in so much pain because I had over 40 stitches. And so I was just, in those 4 days, I just felt like this could not, like, seriously, nobody told me any of this could happen. Yeah. And they had said my swelling was so bad, because she got stuck, because my pelvic was probably not, I did not give it time to stretch. And then her getting stuck just caused so much damage.
Like a battering ram. And that's just talking about the outside. Like inside, you're like torn up. And I think this speaks to the state of, again, how we treat women, how we treat that experience, that it's sort of like you can plan it and then you just have the baby and then you're back. And then your husband's like away and it all falls on you. It's like, it's a medical event and it's like something that deserves time. In this society, we don't take any time. So Alyssa's by herself. Already had a horrible experience, so she has like no batteries to deal with this, and then gets completely annihilated in a birth that you think is going to be this beautiful thing.
Yeah, I couldn't wait. I wanted to have like a drug-free, and because my mom was like, "Oh, I did both you and your sister. I was in labor with you for over 24 hours," and I was like, "Oh, I could do this." And then I was like, no, I can't, and I won't. I'm never going to do. And then I got it the first time, and I was like, why would anybody elect to do this without it? There's never a reason.
No.
Yeah, I'm like,
you don't want an epidural. It's totally. They were just, for me, that was like, I remember how good it felt. Like I was so afraid of getting it. The thing at the time was MS, because like, and I don't even know like the research on that. That's not something that I get into because that's a medical category. But like, I was terrified of getting a spinal headache or MS. Yeah. But at that point, I just didn't care. I just didn't care.
No, I was the same way. I was like, I don't care. Just get this pain away from me.
Yeah. And not that it's scary. Again, it's not scary. Like that's part of birth, and it's like it is a badge of honor to go for that. Because if it was easy, everybody would be doing. But that's how, like, when I was, the only 2 panic attacks I've ever had in my life, like full out panic attacks, was being pregnant. Because you're like, oh shit, like the baby has to come out.
Yeah. I have to do this.
So it's like getting on an on-ramp and there's like no exit. Like you're getting on the on-ramp's coming out somehow. And then just being a parent and the state of the world, even 28 years ago, is like, shit, I can't, you get this protective nature where you're like, oh my God, like I need to protect this kid. So I had full out panic attacks. So both, I tell my patients, go to the mall, which the malls aren't even busy anymore. Go to the busiest place you know, and sit and watch how many people, I just say, they were born, and think, okay, they all got through it. Their moms all got through it. So I can get through this. If they got through it, that's the best advice I could give. But it's a mind screw. And to put, with your husband, of not having bandwidth that he could take off and support you. And a lot of people, their job, that they are making ends meet. If their husband takes off, they don't have vacation time and they have to work because they have to feed you.
Yeah,
they have the baby and buy formula if they need to, or diapers or whatever you're using. It's just so effed up. Like it's so much stress on you when it should be a really good time. And you're sleepless. And you don't feel good. So talk to me a little bit about, like, what started to happen with your mental health, with your relationship? Not to get too much into detail,
Yeah.
but like you couldn't be yourself.
Yeah, I couldn't. I came home 4 days afterwards, and people were at my house, which I was very excited to show my baby, but I hadn't been home in days. Um, I just wanted to be by myself,
Mm-hmm.
which should have been like a telltale sign of like it wasn't like a protective over her like I felt with my other kids where like I didn't want anybody to hold them. It was like I don't want anybody around.
Why would you say like why? What was the difference? Sorry to drill down on that.
No.
Sorry. I'm trying to get from you what I think I know that you mean. So I just want to be really clear. So, was it? First of all, you didn't feel good, right? You don't feel good.
Yeah, I don't feel
What,
good.
what would go through your mind if somebody's like, "Hey, I'm going to drop by. I want to see the baby." What do you feel like in your head you had to do or had to be? Could you be yourself?
No, I feel like I had to be ready. She had to be clothed. I couldn't be in bed. My house had to be picked up. Mind you, I'm not supposed to push. I couldn't drive because I had torn so bad. They were afraid that I would tear my stitches, so I couldn't leave the house,
So you're
and I
sitting there
couldn't.
like a gaping mended
Yeah,
sore.
it was just
Huge, like it's a huge.
yeah,
40 stitches a lot. You are leaking fluids that you've never leaked before.
yeah. I didn't never know any of that
Swollen,
happened.
your whole body is swollen. Like you look like a troll. Like, do you know what I'm saying? Like, I
Yeah,
felt like a troll after. I'm saying everybody does, but I felt like a troll. It's called third spacing because I had preeclampsia. Like, my feet had flubbery fluid, and
yep,
people just drop by. And to those of you who are watching this or listening to this, and you have somebody that has a baby, and I've been guilty of this, coming over to see the baby is more work on the mom.
yeah,
So unless you're coming over to support the mom by doing something, it's not like, hey, let me help you or what can I do? That's more cognitive load for her. If you don't have that personality, stay the hell away from people. Like
yeah,
if you're just trying to selfishly see the baby because you're curious or whatever, if you're truly in it where you come over and you can show up in a way that doesn't tap somebody that has zero freaking batteries to like, I'm going to go do your laundry. I don't care what's in it. Please don't be embarrassed. I don't care that your house is clean. I don't give a shit what you're wearing. If you need to like excuse yourself to go cry or take a nap,
yeah,
but to assume that a woman would let you come to her house, hold the most precious thing that she just sacrificed her whole body for.
yeah,
So, and she has to get herself dressed, she has to get the baby dressed. It's mean. I think it's almost like it's so emotionally unintelligent to do that. Not because you don't want support, but you don't have the batteries at that moment to be everything for everybody, to make it look like the perfect situation that
yeah.
you just,
I'm good. I've got it all handled.
yeah. So talk to me about
Um,
that of like that sort of in the first couple of months where it's just like, what the hell is going on
yeah.
in the
And I
mental
wanted to be a stay-at-home mom. So that was like always like, oh, I can't wait to have kids and be a stay-at-home mom. And then I had her and
health?
shortly after I was like, oh, I can't wait to go back to work.
Yes. Tell me about
Um,
that. Like, what was hard about it? What were you thinking? What did you need?
I felt like I didn't know what I was doing. It was my first kid, and so technically, no, I didn't know what I was doing. But I would look at her like, I don't. Why are you crying?
Yes.
Like I don't know what you need.
And she's
Um,
not interacting or giving you anything because she's a baby.
yes, I'm
Yeah.
like, everyone's like, oh, you'll know their cries. I'm like, no, I don't know your cry. I don't know
Especially
what you're crying
hard.
for.
Especially crazy. Yeah.
Yes. And I was like, I have fed you, I have changed you. I like, you're fine. Like, what could be wrong? And I would just be like, I'm going to put you in your crib because they would be like, if you need a break, like just put him in a safe spot. And so I'd put her in her crib with nothing in it. And I would just go and sit down because I'd be like, well, she's fed and she's changed. And I made sure
That's
before I laid her down that she was she was changed and she's fine. So I'm just like, I'm gonna leave you here because like I nothing else I can do for you. Like I can't take you out. I can't walk. I'm not like you're as heavy as I can lift. And
And people don't understand here. You're not allowed to lift it, but yet you
yeah,
take care of your baby. So if anybody comes at Alyssa for what she just said, you're not being real. And
yeah,
you haven't had a kid that has colic or like I when I teach chiropractors, you saw my presentation. I literally have a section of a 3-minute video of a baby with colic, and I don't turn it off.
yeah,
And the
yeah,
reason I don't turn it off is because I'll see chiropractors like get up and leave, or they're like shifting in their seats, and I'm like, this is for hours. You had it for 3 minutes. So when your patient walks in with a kid and you tell
I
them like,
won't
oh, they're
stop.
feeding off your energy, or you're not doing it right, you need to freaking stop that because
Yeah.
you don't know how it feels. So just want to say that.
Well, and no, the that you say that they're feeding off your energy. That was like, oh, she can feel your tense. She can feel
Yeah,
your
get your ears jammed with like
yeah. And I'm
shit
like,
for
and
hours.
she wasn't. It wasn't even that she was colicky. I felt like I didn't bond with her right away.
Talk
In
to
my stomach,
yeah,
I
talk yeah.
felt so close to her. I couldn't wait for her to be here. I couldn't wait. You know, I'm very close to my mom.
Mhm.
And so I was like, great, I get a daughter. Like, and I can't wait.
Yeah.
And then I had her and, I had told we had celebrated our 1 year and we were taught like we
Oh,
weren't in a great
amazing.
place the first year of marriage and then to throw a newborn on it. And for him to always be gone,
Not on you.
it was very, very hard. It was very hard. So it was almost like you guys can leave or like I'll leave. Like you're so much better at this than me. You guys have a bond that I felt very jealous of, and not jealous of her, but it was jealous of like, you know, I would love to be that way with her, but to me it's like I'm just here to fill your needs. And then, like, you've been changed, you've been fed. Like, I don't know why, what else you could, like, there's nothing else you could need.
Yeah. But that'd
Like,
be
you
a
don't,
horrible feeling. Like it's just
yeah,
you did all the work and your body is the one that suffered. You literally got 40 stitches.
yeah,
And then my second was like that. They liked their dad. They were
yeah,
they loved their dad. Like their dad's energy was like what they resonated with. And it
yeah,
just sit there and I with the preeclampsia and almost like my blood pressure was like through the roof. So I was very sick. So but then you look at them and you're just like, why are we not what am I doing wrong that I'm not
yeah,
bonding with the kid? What's wrong with me? You know,
yeah. Like, they say, like, they sense your mom, you like, they sense you, they like, you're their comfort, and that just
you can't
wasn't
get comfort
it.
if they don't want you.
Yeah. And
It's
then
true.
my husband would work weekends and I would go and I would stay at my parents' house all weekend. And I would literally walk in the door and here you go. And I would go shower or I would go sleep. And I had tried breastfeeding, but the pain of it, which everyone's like, you're doing it wrong. If it hurts, you're doing it wrong.
Like you're being tense.
Yes. And so I was like, I couldn't bear like the thought of like when she would cry and I'd have to feed her, I would just be like, I can't do this. So I
Yeah.
put her on formula because I'm like, I can't.
Mhm.
And she had stomach problems. So it wasn't until like she was probably like 8 months old where I found the formula that didn't give her an upset stomach.
Yep.
And so it was just a lot.
Yeah.
It was a lot. And so I got pregnant with my second. And it was probably like 6 months where I felt like, okay, I can do this. And I finally started, staying home a little bit more by myself. My sister had her first child a few months after me. And I was like, oh my gosh, you guys have like such a bond. Like, I just don't know what I'm doing wrong.
Mhm.
And I don't understand why like I'm so short tempered and why I'm, you know, my mom was like, I never had postpartum depression. My friend was like, oh, after I had the baby, I was great, which I didn't know she had problems during when she was pregnant. Everyone else was like, no, I never, like, yeah, I was like sad or whatever, but I didn't feel like I would be okay if like I left.
Yeah.
Um, where like that was like my only was like, if I leave, like they'll be great. Um,
Because you probably felt like shit about yourself because, like, literally, they're not supported. Like, I need you guys. If anybody comes at her in the comments, I'm going to hunt you down because she's being really raw here, and it's. I just think I just want to speak to providers really quickly, or people that are like lactation consultants. It's your freaking energy. If your patient doesn't feel comfortable and supported by you, you're doing something wrong, not them. And that's what I'm about to say is like there is such a weight of being in this field. If you're working with pregnant women or kids, you need to be extra supportive and check yourself that even if you haven't gone through this yourself, you need to be open to the fact this is terrible for them and this is their experience and you need to validate their experience because it is awful and you have not walked in their shoes. And all this what we're talking about, there's this laced of a change of identity, which is why I call my practice bloom, because for me it's a beautiful transition to find somebody that finds out they're pregnant. I've been taking care of them without being pregnant, not dating. They meet their person, they get pregnant, and as soon as they find out they're pregnant, they change. Like they immediately, their energy changes, their everything changes, how they think changes. And then to watch them go through it, why I'm so passionate is when you have pain or you're, people don't talk about the part you're talking about where you're met with this bullshit from so many people, other women, your mom, and not putting your mom down at all.
Yeah, but it was, yeah.
My mom did the same thing. Like I had 4 kids and didn't have stretch marks. You're like, what the hell? You want to be aspirational and you want to do it right because this is your time to do it when you're met with people that are in professions that should care and not say or warn you about this stuff, not to scare you. It F's with your mind.
Yeah, it does.
And so it's not, and it's not.
But it stays with you.
Yeah, because you felt like it was ruined. Like for me, that's the driving force is that I had 2 pregnancies where my ex-husband treated me like a farm animal. And in the delivery, I was so scared to deliver because he put so many parameters. That's the way we lived our lives for 26 years is he controlled so much of my psyche that like I was afraid to like be embarrassed or have him walk away, or I was modulating his feelings over feeling my own self. And that's the greatest regret I have is not going through pregnancy with a supportive partner who could have done that. And that's why I'm so batshit passionate. I keep using that people's providers, their partners understand that just because you don't understand doesn't mean that you need to be a judgmental T word because as long like when I met you, there was so much, and I'm sorry to get personal, there was so much when we would talk, when you would talk about your kids or your pregnancies. And I'm like, Jesus Christ, somebody really effed you up that you, instead of pointing how beautiful you were, or how strong you were, or how you weren't alone, your kid's 12.
Yeah. And it's still like, I
raw.
I hold on to that experience because it was unlike anything else.
Yeah.
It was my other 3. I had an epidural for each of them. Yes, I had postpartum depression, which was much more severe. Yes, I was in pain with them, but that first pregnancy changed me.
It set the tone. It set the tone, like kind of broke you a little bit where it's like, this is not, that's why I need my back book, What You Don't Expect When You're Expecting, because you don't expect to suffer. You don't expect to be gaslit. You don't expect to be seen as like a subhuman. And I think it's gross. And I am dedicated. You see, you work with me every day. You and I meet at 6 a.m. You're texting me and like up till night, because this is something that's really important. If we can stop a few handful of women from feeling like this so that you change the narrative of how you feel about yourself and what you tell your kids and how you feel about your kids and how you bond with your kids, that's what it's all about. If we can help you feel better, you can bond better, you can feel better as that you're doing it, you're doing the best you can.
Yeah,
so,
you really are. You're doing the best you can. Is the best. Yeah. With what you've been dealt. It's hard when you don't have support.
Mm-hmm.
My husband was always very supportive. I don't think mentally he understood the mental until like my 3rd or 4th pregnancy, where he was much more hands on, but also could pick up like if something's actually wrong with her.
Yeah.
Yeah.
Because it's, and in defense of men, I was gonna say,
They
which
don't understand.
they don't understand. So like, and all the attention is on you,
Yep.
which is like boo-hoo, but it is hard, and it's hard to watch their cheerleading, gymnast, dancer, girlfriend,
Yeah.
who turned wife, turn into a puddle of like, I can't do this, or I feel like shit, or I'm grouchy all the time. And a lot of people are a mirror to somebody else instead of like a very strong man that can sit and not be a mirror. They're the thermostat.
Yeah.
I think for your subsequent pregnancies, he became the thermostat instead of being the
Yep.
temperature changing. And I think that's so important. It's a lot of weight on a man or a partner. I'm not going to
Yeah.
assume husband, to be grounded, to be the strong force that a woman needs. And I have that now where I understand that. Before I did not understand that, of just being calm and steady and holding her so she can be soft.
Yeah.
And I think I'm trying to get women to understand they're not alone. Let them be soft,
Yeah.
and helping their partners understand how to help their wives be soft and break down, honestly,
Yeah.
and not be judged for that. So again, very heavily in the thing, and I'll put this in the comments. If anybody comes at her for anything she said here, you haven't lived it. And if you
No.
haven't lived it, shut the hell up about it. It's on my wall. I'm going to show my favorite quote over here is the woman in the arena. It's the man in the arena. If you haven't been in the arena, shut the hell up about what we've said today, because you're not living our life and you have something that other people don't understand. So just be kind. And I appreciate you sharing your story. And thank you so much. I hope it helps somebody that's out there, because this shit's still happening in 2026. This is Dr. Brandie, and I'm signing off for Pregnancy Pain Sucks. Third module is going to be about work.
Yep.
Good time. See you then. See you next week, guys.
Bye.